All right, I guess we'll go ahead and get started. I want to thank everyone for being here tonight. Um, this webinar is for the new grads. We want to make sure that, we are here for you as a company. I want to be here for you as a mentor for our dental hygienists. So please, thank you for joining. And if you have any questions, feel free to pop it something in the chat, and we'll be sure to get to that before we end tonight. Um, I want to thank EKOS Dental Group for sponsoring this event. I am the hygiene mentor for EKOS. I'm also a clinical hygienist. I work clinical Monday, Tuesday, Wednesdays. So I'm, very passionate about, patient care and, advocating for hygienists and making the profession better as a whole. So I'm really, really excited for this. I have a few people here with us tonight who are going to be partaking in our webinar. We have Bree. She is not a new grad, but she has a wealth of experience and knowledge. So Bree, if you could tell us a little bit about yourself, and you can take it from here.
Yeah. So my name's Bree. I have been practicing hygiene for just about 7 years. I have been in a few offices, so not a ton. I was lucky enough to get into a private practice right out of school. And I did learn a lot, but I actually then recently, the last couple of years, I did transfer over to EKOS, and it has been a little bit different and very positive. So obviously we're going to go more into that. But same thing as Kate, I love getting to know the patients. I really focus on, rapport building and getting the patients to trust me so I can give them the best care. And then the doctors, it's just if they trust me, then the transition to the doctors is a lot easier. So yeah, I love hygiene. I'll be doing it for a long time. So that's
Good.
a little bit about me.
Perfect. All right. And Yvette, if you want to go next, since you're right next to Bree.
Yeah. So I've been doing hygiene for a little less than, I think it's been like 8 months or so. So I'm, fairly new grad. I did dental assisting for 5 years before that. It's definitely been it's it's been a little bit of a struggle sometimes, but I love what I do and I won't trade it for anything, and I worked really hard to get to this point. So there's just a lot of tips and tricks that we can all learn and help each other and bounce off of, and EKOS has been super welcoming with doing it.
Awesome. And Yvette is a graduate from Palm Beach State.
Yeah, Palm Beach State last year.
All right. And then Amanda, if you want to go next.
Hi there, my name's Amanda. I actually just graduated from Indian River State College 2024. So I've been doing this for about 10 months now, so just shy of a year. Prior to that, I was a dental assistant for about 6 months. As soon as I got into hygiene, I was like, oh, okay. So got a little taste of the dentistry world. Definitely hygiene is it's just like instant gratification, being able to help patients right there and then. This is in the medical profession where, these patients come in and at the end of the appointment, they just feel like a whole different person because our smile is just very important. So being able to be part of that is just amazing. So I love hygiene. It's great. Education is number one. That's how we evolve as individuals in the whole world. So education definitely plays such a huge role in this profession. So definitely I found where I belong.
I love that. Well, awesome. So we have a few different things we're going to discuss this evening. One of the big things I hear a lot of new grads coming out, and me as myself when I came, is, as far as the interview goes, when you first come out, what questions should we be asking for? What are the red flags that we should be looking for? How do we go about handling those interviews? So I would like to know kind of, from all of us here that, Yvette, Amanda, and Bree, our own experiences. I know for me, what I would ask now if I went on an interview would be drastically different from what it would be 10 years ago when I started out. So for me, my number one is perio protocol. Like I need to know walking into an office of what is your perio protocol. So I know through discussions, Bree and I have similar stories as far as kind of that being a deal breaker. Like if there's not a perio protocol in place of how we would handle that interview. So I think that's definitely an important thing to know what your deal breakers are. Know what you're not going to budge on. If it's, appointment time or perio protocol, making sure going into that office and that interview of what you want out of it is really important. So Bree, I know I just talked about the perio protocol. What would be another one for you at this point in your career that would be an immediate question you would ask or something you would look for, I guess?
Yeah, I mean, definitely team dynamics.
Mm-hmm.
It's awkward. You don't want to ask about turnover, but that is important. That is something that I saw a lot of at my last office, which was tough. And it's tough for the patients because they don't understand it. But yeah, asking about, just the team dynamics. And if you do a working interview, seeing how that dynamic is, seeing the energy when you walk through the office, like that's really important for me. Because you want to, obviously, these are the people you work with every day, including obviously the doctor. Like you guys have to jive well and have the same energies and be excited about your job, or it's just going to be work and it's going to be monotonous and boring, and you don't want that. I think another thing too, which I see a lot of, I follow different pages and forums, but this is sad, but this is a question to ask is, am I expected to clock out if there's no patients?
Yeah.
And, I'll be in pages that say, I started this new job and my doctor wants me to clock out. And again, it depends on however, you're getting paid, but that is an important question to ask because you may not know that. And then you have cancellations and, just something to consider. And how they deal with cancellations and policies. Are you expected to call and fill? Like what is, you have the front desk, just making sure you're on the same page about everything is really important. And which will, goes into protocols. What is your protocols for perio, but, cancellation protocols, everything. And those are questions you just don't know, going into it. You don't know what to ask. So obviously knowing what I know now, it's, with experience that comes, but obviously this is why we're doing this. So you guys have a better idea of what to know and what to ask.
I agree with that as far as what is the expectation. We all know as a hygienist what the expectation is when we have a patient in our chair, but what is the expectation when we don't have a patient in our chair?
Right.
And some offices, they know what the expectation is. So it's kind of second nature to them. But when you're the new one in the office and all of a sudden you're just supposed to know, that can be really frustrating. And, so having a clear definition of what your expectation is at all times, I think is really important. And knowing like, well, no, if what you are able to, say no to and what you, like I said, have your boundaries, have your things that are not negotiable. That is really important as you start your career.
I think too, going with the perio protocol is, there may be a protocol, but does the doctor believe in it, right? Is it the office manager's, protocol? Again, being on the same page about everything. And are they going to back you when a patient is refusing perio treatment? Or is the doctor going to say, just do a prophy? They're here. Because I also have friends, and my sister-in-law, she works in an office and it's prophies all day long. And I'm like, this is your license, it's not just it is your license. And again, then you're pressured to do something you don't want to do. So again, you have to ask these questions before and remember that you're interviewing them as well. Like you obviously are selling yourself. And, you're going into it with no experience. You can let them know that you can mold me the way you want, but you have to have boundaries for yourself. And again, yeah, going into it before the interview, prepping yourself to ask these questions because it gets tough,
Yeah.
because you want
And it
the
gets-
job. You want the job.
Right. You want the job, and it's overwhelming as a new grad. And my experience, which obviously the industry's changed greatly since I was a new grad, but when I was in these interviews, it was almost as if they're doing me a favor, right? They're doing me a favor taking a chance on a new grad where, new grads come out, the latest technology, the latest research, you guys are on top of it. Yes, there's a lot of things you still have to learn. You have to learn to, really hone in on your time management or the verbiage with patients, but that's all you can learn that, but if there's a hygienist who maybe they've been practicing for 30 years, but they haven't looked at a continuing education course that really meant anything to them in the past 30 years. So there's a lot to be said about, yes, you're a new grad, but you bring a lot to the table in terms of the education and your knowledge. So
Yeah.
don't ever think like, oh, I'm not qualified. There's so much more learning, yes, that you need, but you have it. You can build upon that. So
And when you come out of school, you're hungry. You want
Yeah.
to learn. You want to
Mhm.
learn, and that's why, you're like a sponge at that point, and that's why it is very important to potentially see different offices in the beginning, whether that means temping. And that's something a vet did in the beginning. I did not temp in the beginning. I did one interview, and that's a job I was with for 5 years. And then switching offices now with EKOS, I've learned so much more because you just see a whole different side. And I was with a great doctor before, but again, it's just you just see,
It's just different.
yeah, there's variety, right? And you learn what you like and what you don't like. Like I said, especially for a vet, because she did temp me more, and
You
Yeah,
see the good, the bad, and the ugly, right?
yeah,
yes, yeah, you see what you don't want and you see what you do like, and it's great for experience to just kind of throw yourself in there, it's definitely an experience, but I feel like I learned a lot, and I think I did it for like 2 months, and I feel like I went to many different offices, and it was a really great way to like immerse yourself in it and just see how every office is, the different softwares, the different protocols,
Yeah.
just it's definitely, I feel like it helped with experience a lot.
Yeah.
Also, we can assume that most things are digital now, but it
Yeah.
is
Yeah.
important to ask, are you digital? Do you use paper charts? Because
Right.
some
Yeah.
offices still use paper charts. And again, if you don't ask those questions, you're just not going to know until you're in it. And you're, writing paper charts, perio charting, and that's not always efficient. So we want to work on the
No.
timing, and that's definitely going to slow you down.
That's gonna be hard to hone in on those time management skills.
Yeah.
And I was gonna
Um,
say too, sorry, Kate, before you
No, go ahead.
I was gonna say too, I think it's super important to do a working interview,
Mm-hmm.
because at the last office where I worked, I didn't do a working interview. And I think they were a great office, but they did have the paper charts. And I think that's one thing that I definitely that would have turned me off. I probably wouldn't have worked there if I knew. And a working interview is just super important to know the environment and the doctor and just how they work.
Absolutely. And,
Yeah.
and like Bree said, like you wouldn't have known to ask, like, are you digital or do you use paper
Right.
charts? Like that wouldn't be something that you would think to ask. And
And
You kind of just assume.
yeah,
and I will
exactly.
say some older private practices,
hmm
they still use paper charting, so
Yeah.
Yeah.
I'm a huge believer in working interviews. Obviously, working interviews should always be paid. You should you and like Bree said, you're interviewing as much as the office is interviewing you. Do you align with the doctor? Are you
Right.
guys on the same page? There's great doctors out there that you might not align with, and that's okay. But making sure you guys are in alignment, that's how you're going to find your forever home. That's how you're going to find, where you want to be in an office. So working interviews are so super important. So I would definitely always recommend making sure that you take that opportunity and do that. And if it's not asked of you to do a working interview, ask to do one.
I did.
know?
I asked to
Yeah.
do one, and he's like, "Yeah, we don't really do those." And I should have taken that as like a red flag, but
Yeah.
but they were
didn't
so
know.
nice.
Yeah.
Yeah, and they were so nice, so I was like, you know what, we'll just try it, and it was fine, but just
Yeah.
not at the end of the day. It's
Yeah, or even shadow, if that's
Yeah.
something they don't want to do, they don't want you to see their patients, fine. Like, can I shadow your
Mhm.
current hygienist and just see the workflow? How do you
Yeah.
streamline? How, what's the day like?
Right, because anyone can say anything in an interview.
Of course.
But
Yeah.
until you're actually seeing the reality, that's when you know, like, okay, yeah, no, this is not what you said, or this is
Yeah.
exactly where I want to be. So I think that's important. A couple different things I would definitely want to make sure, as far as if I were to interview now, would be what's the protocol for replacing instruments? Is there a budget in place? Is there
Yeah.
because there's so many times where I here's hygienists, like on the forums, like Bree was saying, they mention about not getting instruments or Cavitron chips in years. Like
Mhm.
that's insane, because it obviously, especially Cavitron tips, like they wear down, and they're not
Yeah, that's just
effective.
this.
So
Yeah, it
we
goes
need
with
to
the
make
standard of
sure.
care.
hmm
Mhm.
So definitely, I would want to make sure that is being addressed. And obviously, what is the office's policy as far as when patients come in late?
Right.
Yeah.
Are we allowing patients to come in 20 minutes late and it's no big deal and you're just supposed to rush through the appointment? And making sure everyone is on the same page. Like Bree had mentioned before with the perio, if they can have a perio protocol in place, but are we actually following it?
Mhm.
Is it actually being, you know, done? So that's would definitely be something that I want to make sure like is actually being followed through with. I'm curious, how many interviews did Amanda, Yvette, Bree, how many interviews did you guys go on before deciding on your office that you're at?
So I personally did 4 interviews in
Okay.
total. None of them were working interviews, but I did shadow. So going back on making sure that you're asking all the right questions, the questions are going to help you weed out where you belong and where you do not belong. Because everyone has a different personality. Every doctor is different. I just made sure I asked the right questions, and sure enough, I pretty much made my decision and very happy with it. So,
And
yeah.
was there a certain factor that made you decide, like, this is where I want to go? Like, was there something specific that stood out to you, or just kind of
Yeah,
everything?
actually, I have 2 things. I have number 1 for me was the doctor. My doctor, hands down, we are yin and yang. We are on the same page. You know, when I do have patients who are saying, no, I just want a regular prophylaxis, and, I'm not doing the deep cleaning, he will come in and he will back me up 100%. We will go over, scientific reasons as to why this needs to be done. Charts will be taken out. He will take the time and explain to the patient alongside with me. So that right there is just amazing. And then number 2 would have to be having a mentor. Definitely coming out of school, and just not knowing everything right off the bat, you have someone like Kate to go to and have questions, to be answered. Even days where you're frustrated and you're like, I don't get what's happening. Like, why? She's there to help you. So that was also something that stood out for me personally, because you want a support system. You want someone there by your side to help you and succeed. And like, help is just it's great to have if you have that. So that's great. So those are the 2 things for me.
That's
For sure.
amazing. Before I get to that, there is a question I just want to get to really quick. When you talk about perio protocol, what exactly does that mean? So perio protocol is something you should, I suggest have every office has in place, as far as when you are deciding what treatment that patient needs in terms of their cleaning. So if it's a healthy mouth cleaning as far as a prophylaxis, or if it is a gingivitis patient being categorized as a 4346, or if it's periodontal treatment needed, knowing where that stands. So anything, with staging and grading that falls into needing more than a prophy or a gingival scaling would be placed in the perio protocol. A lot of perio protocols have whether someone is administering local antibiotics or other adjunctive therapies with that. And then what does that look like for their recall appointments? Are we bringing them back in 6 to 8 weeks to evaluate? Are we bringing them back in 3 months? The perio protocols are definitely making sure everyone is in alignment and every patient is essentially getting the standard of care, right? We want to make sure that just because Mr. Jones is, been a patient for 50 years now, and he's always been getting prophies, but he has perio, the protocol, it's very easy to then, have the protocol in making sure Mr. Jones is getting the treatment he actually needs. That clarified your question as far as the perio protocol means and what that means but having it written down is key. Everyone can verbalize it, but having it written down, formatted, is really important to keep everyone obviously on the same page and accountable. Like, no, this is our perio protocol, especially if you're somewhere where it hasn't really been done. So if it's something newer to the office, making sure you guys can have a reference, like, no, we talked about this and this is what we decided. Like, let's stay with this. So having it written down is 100% needed, I think, for it to actually be followed through with.
Yeah.
Um,
I also want to mention something on that topic
Yes.
too. Even with us having like the perio protocol, we were all able to come together and understand it as a whole. That way, one hygienist isn't interpreting it a certain way, and then this one is looking at it in a different way. We kind of all got together and we understood it all as one, which was great. So there was no missing areas or no gray areas. Like everyone knew exactly what we were talking about, and as far as perio protocol.
Right. And essentially that's really important because if you have the husband, let's say, in your chair, and then the other hygienist has the wife in their chair, and you guys are treating completely separate ways, that's very confusing to a patient, right? Like, well, why is she getting X, Y, and Z when I'm getting this? So making sure obviously the hygienist and doctor need to be on the same page, but the whole hygiene team definitely, they need to be treating the same way, the same verbiage, the same, how we're explaining things to patients. That needs to be very aligned to make sure patients, no matter who they're going to, it's essentially the same experience in ways. Obviously, everyone's going to have their own ways of going about it, but the bulk of it should be similar. We should be having the same message. And then Melissa, let me have Yvette just follow up that one last question as far as what is there a deciding factor that made you decide on the office that you decided on? Was there one thing in particular, or was it just kind of things fell in place?
Honestly, I feel like it was just like we said, the vibe, with the office and the doctor being who she is and just really, like you said, backing you up, and just feeling comfortable too and like asking questions, having those protocols to kind of lean back on and just so you don't feel so lost, and having that support. And I think that just made me feel 1,000 times more comfortable and being able to ask the questions and feel like I just wasn't going to feel
Judged.
Yeah.
Yeah, like it was a silly question. Yeah. And that's where the growth comes in, right? So, that's super important.
Yeah.
Yeah.
That really is. So Melissa is actually a new Arrestin rep in the area, so she said she would love to chime in. So I'm just going to let her very quickly chime in here.
Hey guys, I'll make it really quick. First of all, I just want to applaud you guys because this is such a great idea to brainstorm and kind of help the next generation of hygienists get their footing. And hi, Ashley. Um, I I didn't turn on my camera because I just came in from New Jersey in a training. So I was like, if it's okay, I'm not going to turn on my camera. But I love what you're saying about protocols because I think that is one of the, and you hit the nail on the head, Kate. Like if you have a husband and a wife in the chair and you're doing two different things, you know, at Aura Pharma, I'm your rep for Arrestin, so it's an antibiotic for gum disease, and we have a whole series of educational learnings to help the office really come in line with a protocol. So I'm looking forward to like rolling that out for you guys because it's a really great conversation. So everyone can kind of share where they're at and also get in line with what the team wants to do as as a protocol. And you guys probably already have an incredible protocol, but just kind of reinforcing it and then talking about some of those talk tracks that can be difficult. I definitely have a lot of resources for you guys, and I want to support you with anything that you need because it is hard. It's not just about, you know, hygiene. It's also about communicating with the patient effectively. So I would love to support you guys in that. And we'll be rolling out some lunch and learns for you guys soon. So I will meet you all in person. But yeah, this is a great way to I everything that you guys have said so far, I just second it because like the working interview, being in alignment with a doctor, asking a lot of questions, like all of that. So I don't want to take up too much time, but just wanted to let you know that I do have resources for you.
Thank you, Melissa. And for anyone who is joining who's not a part of EKOS, I'm, Arrestin or Pharma. They are a great resource. So I encourage you, if you guys, need patient education, reach out to your local rep because they are such a good supporter of, not only dental offices, but hygiene departments. So the next thing I kind of want to talk about is, which this is a huge topic, is private versus corporate. Corporate dentistry has a huge stigma of not being ideal, right? And I want to kind of dive into that with, our own experiences and how we look at things, because I think there's a lot of, obviously there's people who do it right and there's people who do it wrong. And I think there's a lot of misinformation that it's, if it's a DSO or it's corporate, it's 100% bad. So I kind of want to dive into that a little bit because I remember when I was about to graduate, I myself said, I am never working corporate, not doing it. I'm working private practice. I want to work private practice. And that was pretty much across the board of my graduating class, how everyone felt. That's what everyone, I want to work private. I want to work private. And that's how everyone always talked. So I think now looking out, it's going to be about just shy of 10 years of being in the field, right? And how I look at things now is completely different. So a couple of things I want to just start guys talking about. And what I've noticed is a lot of it's already been mentioned, right? So the support, the mentorship, the community aspect of having, more than just maybe one doctor, one hygienist, and that's it in the practice. The protocols.
Yeah,
You are
structure.
going to get the protocols and structure. Obviously, with bigger DSOs or bigger corporations, the benefits and that aspect. But one thing really that always sticks out is it always goes back to the support, because and I worked for a great privately owned dentist. Like I did. But at the end of the day, I never felt more, I guess, I haven't ever felt as much of a provider
Mhm.
and have as much of a voice that I do now. It's when I worked under one doctor, at the end of the day, it was like, well, what is it's him. He was always the one who dictated everything. There wasn't a protocol. There wasn't a, you know, oh, they're 20 minutes late, just see him anyways. It was always whatever the doctor wanted, which, is great, but um I struggle with that looking now of how did I do all that new patient appointment in 1 hour, right? Like,
Yeah.
why would this? I didn't have a voice. It's what it was. Um, so I'm curious, because I've had, I was part of the onboarding process for both Yvette and Amanda, and I heard the concerns,
Mhm.
especially from Yvette. I heard the concerns of what that meant, what corporate meant to her. And I would like Yvette to kind of elaborate on that because I'm pretty sure she kind of knows where I'm going with this, is where she was hung up, um, and how she has felt since being part of a DSO.
Yeah. So I think a lot of it was like the time management,
Mhm.
coming straight from school, um, which I feel like that takes time for anybody. Um, but just feeling like also, there's a monthly goal that sometimes will come into play, and I was like I didn't want to be penalized for not reaching that, and um just feel the pressure, I guess, of having that, because I did have an interview with a different corporate, and I just felt like I got a weird vibe with it.
Mhm.
Like I felt like it was going to be held against me if I didn't, and it just it felt like I was gonna have to work Saturdays. It was a whole
Yeah.
thing. So I was super concerned. That was definitely one of my top things I was worried about. But being with the company for as long as I have been now, I can say that that has never ever felt like an issue whatsoever.
Mhm.
And if anything, it's been really good because I can really just have that goal every month, and if I reach it, I reach it, and then if I don't, then try again next month. It's nothing being held against you or anything like that.
Yeah, and I want to touch on that because sometimes that's usually the goal is usually one of the biggest things is where people, corporate, all they care about is money. They just want you to make a goal,
And
and
it's so not that. It's so
it's
not that.
not. And it's as a hygienist, as a provider, you can walk into any dental office, right? And you can ask the doctor how much they produce, and it's okay. But
Right.
for some reason, as soon as people try to, a hygienist starts talking about it, there's this, oh, they're doing something wrong, or oh, they're over treating, or they're just all about money. So there
Mhm.
is, for some reason, and I think it's getting better, when we have the top hygienists in the industry, you know, putting things all over social media and bringing attention and awareness. I think that is amazing for the profession because it shouldn't be a bad thing that hygienists are talking about how much they produce. Because when you look at production, you get production based off the service you provide, right?
Mhm.
What do we do? Mostly what we're doing is treating perio. We also know how prevalent perio is in the world. So we don't have to go make up perio. We don't have to go make up
Right.
treatment.
It's
But if
there.
we're
It's waiting.
Yeah.
it's there and waiting. But if we're addressing it, which is what a good hygienist should be doing, in treating it, the money comes, the production comes. It's that when we're not acknowledging the perio that's there, that's the problem.
And that's what you said too. You'd be like,
Mhm.
you're treating it, you're doing what you're supposed to be doing, the money will
Yeah.
come,
Yeah.
and that's how it's been happening.
Mhm.
Yeah.
You
Yeah.
just you just do the standard of care, you do what you're supposed to do, and you treat the patient, and there you go. You reach your
Yeah.
goal. It's
Right.
not.
Yeah, and it's also it's very important to me of having a balanced schedule, right? Like if you don't have a balanced schedule, that's also going to play a role, right? And I always use the analogy, there would be no office manager that would ever put a day after day after day after day of fillings all day for a doctor. Not going to happen, right? Like they need production. So the same thing goes for hygienists. Like I don't want to see 10 prophies in a day. Absolutely not. First of all, that is boring. And it's that repetitive doing the same thing, same thing is horrible, us for our bodies. So having a mixture of patients that need x-rays, patients who don't need x-rays, having a new patient, having an SRP, having a balanced schedule is also how you be productive. So there's so many layers that go into how to reach your goal. It's not just a one thing. It's so I always look at it as if let's say Yvette didn't make her goal, then there's things to look at. Okay, are we balancing her schedule? Are we giving her those opportunities? Or does she never see a new patient for the entire month and she has cares all day long? Well, then no, she
Yeah.
probably won't reach her goal. So I think there's a lot of conversations that still need to be had about, corporate dentistry and what is expected. And like I said, I know there's some out there that the experiences are horrible and they are, not every private practice is good. Not every private practice is bad. Not every corporate dental is good. Not everything's bad. So I think it's just knowing what you're getting into is really important.
I do want
I
to
think-
touch base on something too. As a new grad, knowing like I feel like also too we should know not only clinically, but we should also understand dentistry from a business standpoint as well. We can provide great care, and do everything for our patients, but at the same time, we have these four walls, we have x-ray machines, we have sensors, we have instruments, we have everything that you need to be a great clinician. So you have to also put that into play, that this is also a business at the same time as you are providing clinical care for these patients, but you have to look at the background that this all comes into play too. So it's definitely a lot better to understand both sides as a business standpoint and also, clinical. To understand that.
Agree. I 100% agree. I think that's really important. I think that's also when the mind shift kind of you think differently. Once you acknowledge that, your mind changes and you understand, it's no secret. Industry standard is hygienists are to produce 3 times their hourly rate. So how do you do that? There's certain things you start thinking about. And it's all that business side of it. So, as new grads, I highly encourage you to continue learning. Don't stop learning. Don't stop being involved. I can say when I got out of school, I pretty much was like, yeah, I'm done. Like, got my job. I'm gonna, live life, right? I've grown so much more in the last 5 years. I practiced for 5 years. I pretty much it is what it is. Learning, you get that passion back. Keep learning the newest technology, strive to be the best. Follow the top in the industry. Go on Instagram. Look at Katrina Sanders and what she's saying. Listen to her podcasts and the Amber Augers. Listen to those people who are at the top of the profession and who are pushing our profession forward. Those are the people you want to be listening to. Those are the people you want to strive to be. So we're running out of time. It goes really fast. It's always like, think you have all this stuff that you're going to cover and we run out of time every time. So as we are finishing up, I do want to touch back to your year as a whole. We kind of talked about it a little bit earlier, but any takeaway, Amanda or Yvette, that you guys is hygiene what you thought it was going to be for you? Has there been the biggest challenge, something that stuck out within this last year for you? I would love to hear kind of looking back now after a year.
I think giving yourself grace, giving
Yes.
yourself time to evolve and, conform to the new norm, giving yourself just, reasoning, it's okay if this patient, did not want this, or, you did what you could.
Mm-hmm.
And you just go with that. You do what you can, and you do it with everything that you got. And that's what matters.
Yeah. I was going to say, we're limited to our hands and our instruments, and we do what we can do, and we do the best that we can, but nothing's going to be perfect. It never will be. And just don't have, especially as a new grad, like she said, give yourself grace, because there will be hard days where you feel like, oh, maybe I should have done this, or I should have used this instrument, or I wish I had that. But you learn from that, and just keep growing. I mean, you just have to give yourself grace, literally.
Yeah.
And we're always growing. I mean, I'm 7 years in and I'm still learning. I'm still,
Right. And I'm still going to
the other hygienist being like, hey, what would you do here? Talking to my doctor, what would you do? I'm thinking about this, but, so again, collaborate and, and there's always gonna be lifelong learning and growing, and that's how you don't get burnout, and that can happen. It's, it's very repetitious, but if you're learning new things and technologies, then it's, and that's why change is good. And that's why I switched over from private to corporate. So, and it's been great.
And
So
it's all just experience. You just build on that, build on it. And I mean, that's what we have to do. That's how we learn.
That's
how
where
we grow,
and like you said, it's something that's never going to stop. Like you're going to always be able to, learn more things and grow. So, I want to thank Bree, Yvette, Amanda again for being part of this. I want to give a big shout out. Thank you to Ashley and Joey, Dr. RK, for helping with the tech side of things. I want to, once again, thank everyone for joining. If there are any questions, please feel free to contact me at this email, kate@ekosdentalgroup.com. I would love to, answer any of your questions. And I hope everyone has a wonderful evening and a happy birthday, Yvette.
Thank you.
And have a wonderful weekend.
Okay, you too.
bye.
Thank you.
Thank you all.